Good morning, everyone.
Good morning, sir.
I am Devi Calostri.
I am Arlo Torino.
We are the topic presenter. It's all about healthcare. Healthcare practitioners focus increasingly not just on doing something right, but on doing the right thing. And doing the right thing in healthcare depends on the availability of good information.
In the future, many of the improvements in healthcare will come not from better drugs or better doctors, but from better managing information. Healthcare as practitioner and patient increase only embrace the IT tools of the digit, digit, digital age.
As discussed below, it is helping provide for key benefits in healthcare. First is reducing healthcare costs. Second is increasing access to the health information. Third, improving the quality of healthcare. And the fourth is increasing access to the healthcare.
Reducing healthcare costs. As healthcare costs continue to rise, finding ways to stem the increases in healthcare costs while improving the quality are critical. And given that much of healthcare involves generating, processing, and transmitting information, it is not surprised that IT can play a key role in reducing costs.
To avoid wasting money and effort, hospitals must consider the extensive training, support, and workflow process development that need to accompany any investment in health IT.
Some hospitals have already wasted millions of dollars on health IT system that failed to generate cost-saving benefits. Increasing access to health information. First, care has been one where the doctor had the information and the patient received it.
One reason that some individuals are not more actively involved in managing their own health and healthcare is that they have bought into the idea of the doctor as the expert, believing that the doctor always knows best.
By providing patients with access to more and better information, IT empowered them to make more informed healthcare decisions. By increasing patient access to their own medical records and to a plethora of information to help patients make better decisions, IT has the potential to improve healthcare.
Personal health record and new web-based tools individuals can manage their health information online as easily as they manage their finances.
Improving quality of care.
Three,
The-
impor- three important ways in which the quality of healthcare can be improved are by: first is reducing the number of medical errors.
Second, improving our understanding of the effectiveness of healthcare intervention.
And the third is introducing new, more effective diagnostic and treatment interventions. As discussed below, it is playing a key role in all three.
Fewer medical errors. Most healthcare errors stem from limited or mistaken information. A drug is given to the wrong person. A pharmacist misread the dose on the prescription and dispenses the wrong dose. A doctor does not know the most accurate medical test for a patient. Health IT can reduce this and a host of other kinds of medical errors, thus increasing patient safety.
Health IT can help reduce medical errors by providing accurate information when it is needed. Medical practices, for example, can improve patient safety by using computerized physician or order entry to eliminate the ambiguity of handwritten medical orders.
To provide additional improvements in the quality of care. CPOA can be used in conjunction with clinical decision support system.
Improve understanding of the effectiveness of health interventions. First is it can equip health care providers with new strategies and methods of preventing, diagnosing, and treating medical conditions. More generally, health IT can help improve medical care by making it easier for doctors to provide evidence-based medicine.
Second, as medical research becomes digital, researchers will be able to use data mining techniques for medical research.
In addition, healthcare providers will be able to use rapid learning networks to spot dangerous side effects from drugs or other treatments, as well as identify effective treatments more rapidly. This rapid learning system will also greatly increase the knowledge base of evidence-based care.
New and better methods of diagnosis and treatment. IT is playing a key role in introducing new, more effective diagnostic and treatment intervention. As described below, researchers have developed or are developing IT-enabled medical device that can be used to perform sophisticated diagnostic tests outside a doctor's office. IT-enabled prosthetic and orthotic devices far more sophisticated than any used in the past. IT-enabled smart implants that permit doctors to monitor and treat patients remotely. Robotic surgical techniques and many other technologies that improve diagnosis and treatment.
Second is given the integrated circuit are in everything from cars to cell phones. It should come as no surprise that they are increasingly part of all types of medical devices.
The third, IT-enabled medical devices that have been developed or are being developed include portable devices that can be used outside the doctor's office.
Healthcare providers will be able to use rapid learning networks to spot dangerous side effects from drugs or other treatments, as well as identify effective treatments more rapidly.
As medical research becomes increasingly data intensive, IT will play an even greater role in storing. Rural India, this level of opportunity means that doctors can carry the compact ACJ device with them as they travel from village to village, thereby ensuring that all patients receive better care. 34. One of the most amazing uses of IT in medical devices is in increasingly sophisticated prosthetic and orthotic medical devices.
A wide range of prostheses, from artificial limbs to cochlear implants that allow hearing, have emerged because of a combination of factors including faster low-power processors, improved biosensors, and a better understanding of the human brain. Scientists have been designed an artificial silicon retina microchip to restore lost vision.
Other benefits of IT can be seen in areas such as digital mammography. Digital mammograms use the same X-ray science as other mammograms, but using a digital receiver in lieu of film yields a number of benefits, including less radiation exposure for the patient, immediate lab result, and most importantly, more accurate readings.
Advantage, advan-
Advance.
Advance in the fields of medical imaging, the robotics have even enabled computer-assisted surgery.
One of the most successful example of grid computing in healthcare is the cancer biomedical information grid. This initiative, overseen by the U.S. National Cancer Institute, is the result of a collaborative effort by healthcare researchers to build a flexible online platform for cancer research. The infrastructure consists of multiple tools, applications, and data re- reposit- repositories that facilitates research, encourage, encourage collaboration, and make data from disparate sources more accessible.
Using high-speed networks to transmit real-time audio, video, and health data, surgeons can remotely operate robotic arms in an operating room thousands of miles away.
IT is enabling researchers to develop more advanced pharmaceutical treatments. And in particular, researchers have looked to grid computing as healthcare research becomes more data and processor intensive. By distributing storage, data analysis, and data processing across a grid. Grid computing enables participants to build better, more advanced systems together than they would have been able to build alone.
Finally, it should be noted that the most important medical breakthrough of our era, the unlocking of the human genome, would not have been possible without it. In particular, the innermost processing power found in today's supercomputers, the Human Genome Project sought to correctly analyze and sequence the 3 billion chemical base pairs that make up human DNA.
The telemedicine system can also be used to provide assist to healthcare for individuals in remote locations who would otherwise not receive care. First, the conversion of health images into digital forms that can be sent over telecommunication networks has allowed the development of another application of telemedicine known as teleradio is the electronic transmission of radiological patient images such as X-rays, CTs, or MRIs from one location to another for information and consultation.
The good news, too, is that IT is helping to break down geographical barriers to healthcare by enabling patients to have access to top quality care without necessarily being physically close to it. That's all, and thank you.